It's really, really amazing. We have a special guest, Dr. Kelly Doran, and I'm going to let her introduce herself and what she does. She has one of these big, long, amazing titles because she deserves it. And she was working in the emergency room in New York City last night. She's on the front lines of COVID and homelessness. And tonight's conversation is going to be extra, extra special. So let me bring in Dr. Kelly. Hey, thanks for joining me.
Hi, thanks so much for having me.
Um, this is really a pleasure because except for our little pre testing, this is the first time that we've actually had an interactive conversation other than Twitter.
It's true. It's true. And I haven't mentioned this to you before, but I've been a huge fan of yours, Mark, and the work you do ever since I first saw you at a conference way back in, I think, 2013. So this has been a long time in coming, and I'm really happy to be talking with you.
Oh my gosh, you're talking about the homeless healthcare conference, right?
I am. I
Yeah,
am.
oh my gosh. No, in New Orleans,
Yes.
that was truly an honor. Oh my gosh. Because that was a new tribe for me and it is you don't know how you go over. You know, my message is
Mhm.
more advocacy, which is why they brought me in, and it's more of a medical crowd. So thank you very much for saying that. And I have to say, you're a hero of mine. How Dr. Kelly and I first connected was she shares a lot about stigma in the medical field. So we all think about how the general public, or at least I think a lot about how the general public, um, there's stigma in the general public, but there also is in social services and even HUD and the medical field. And that's how we first bonded. And now that, this COVID 19 and coronavirus and all this madness, and there's all these conspiracy theories and everything else, you've become my go to. You've become my go to. If there's information that on whatever media that's talking about the virus, I go, well, let's go see what Dr. Duran's saying. And you're always sharing the truth, and I really appreciate that.
Well, thanks.
Tell me or bring us in who you are, what you do, and let's just start.
Sure. So, I'm an ER doc. First of all, I work at one of our city hospitals in New York City in Manhattan. I work in the ER, usually 1 or 2 nights a week, and then the rest of my time I spend doing a whole variety of, well, it used to be research related to homelessness, but since COVID started, it's mainly a lot of yelling and screaming and advocacy related to homelessness and COVID. So I sort of wear multiple hats and combine those two things.
Since you started about screaming and advocacy, earlier today you shared about how now the buses, and I think you said, like, this is predictable or something. You started a tweet. I was
Mhm.
setting up for tonight. So um, it's for those of that you don't know, homeless people will often sleep on the subways. It's safe if they can get fare. They sleep on the subways, um, public transportation. But in New York City now, their police are actually, I think it was 1,000 police officers are
Yeah,
now going down and removing people. And
yeah,
what the article you shared tonight was that they're now going to buses. You want to tell us
yeah,
about all that?
yeah. Yeah. So what's happening in New York is that like you said, Mark, we have a lot of folks that spend the night on the subways. Our last, they do the annual counts, which of course are always undercounts and not great anyway. But at our last count, we had around slightly more than 2,000 people in New York City who were sleeping on the subway the night that they did the count. New York City is a little bit unique in that we have most of our folks experiencing homelessness are in our shelter system. So, we have like 60,000 people in our shelter system. But for the people not in the shelter system, we have people that are, on the streets or in parks, but a lot of folks choose to be in the subways as kind of a safer place. And, I don't, yeah, it feels a little weird talking about homelessness to this group of a lot of folks who have been homeless or are homeless. And so, way more, but, like a lot of this audience might know, we have folks that don't want to go into the shelter system for a variety of, mainly pretty good reasons about experiences that they've had there in the past. So we do have people in the subways, including now during the coronavirus crisis. And, what has happened that just started on Tuesday night was that the city and the state kind of collaborated and decided that they were going to close down all of the subway stations in New York. That's like 500 subway stations and all of the subways between 1 a.m. and 5 a.m. every night. The reasons for it, they say they're closing it down to clean and disinfect the subways, but what they're also trying to do is sort of force all of the homeless folks out of the subways. They have outreach workers at some of the stations and nurses and people trying to connect folks with shelter and offering them shelter. Of course, a lot of people, they're in the subway because they didn't want to go to the shelter, but they are trying to offer. They did, they said they connected 130 people the first night with shelter, but you've got 500 subway stations in the system. So, the response is mainly through the NYPD, not through
and right
outreach.
now, I mean, shelters to begin with are not great places.
Yeah.
And with this, social distancing and coronavirus, shelters got to be scary. If I was out on the streets, I would fight. I mean, I would fight going to a shelter. I lived in a shelter for 7 years, right?
Yeah.
Shelters suck.
Yeah.
But with coronavirus, you can't blame them.
Yeah, I totally. And, the shelters are they're trying to follow the guidance around social distancing. We'll put the beds, 6 feet apart, we'll stagger the meal times and everything. But, I think it's just in any type of congregate setting, it's just, really impossible to do that. Actually, Mark, I'd be interested in your take on like whether is social distancing even possible in a congregate shelter? Like, how,
I actually, I have some very mixed feelings about all this because I do believe shelters play a vital role. Shelters that are part of a system that takes people from the streets into housing. I need to clarify that because, like in New York, because of the right to shelter, there's been this huge buildup of shelters and people just live in shelters indefinitely. That's not good. So, if a shelter is part of a system that takes people from the streets to the shelter to housing, it's a very good thing. And there are some good shelters, and shelter operators now are faced with this huge challenge. So, staffing is an issue, funding is an issue, hygiene, sanitation. I mean, it just messed up the world. And there's no housing, to move people in, and it blows my mind. You have Josh Dean from Humans New York, Human New York, or the advocates in San Francisco. You have the advocates in Los Angeles are fighting for hotels, and they're not putting the hotels are empty. It doesn't make any sense to me. So I I want to close this by saying my hope is that this virus, this coronavirus, will be a wake up call that we will go for or put more emphasis into housing, funding,
Hmm.
support. I hope that is the outcome. I hope when people leave the hotels, they're not just exited back to streets.
Hmm.
However, in a real world, seeing how advocates are fighting for these hotel rooms, it's concerning.
Yeah. Yeah, I mean, I totally agree. I also hope that this just wakes people up to realizing that the current situation where we have, thousands and thousands of people kind of warehoused in shelters and homeless in general is just not a good situation. I think people are starting to talk about it. I've seen some kind of talk about, hopefully this is a wake up call and hopefully something comes of it. It's funny, I was reading one of somebody I worked with in the past on research is Dennis Colhane, and I happened to come across something he wrote in 1991, so 30 years ago in the New York Times, an article about, how, we need an end to this. Shelters are not the answer to homelessness, housing is. And I feel like we're still beating that same drum now. And, one would hope it wouldn't have taken a pandemic to get us here. But now we're in a pandemic. So,
Yeah.
you know, I'm hoping maybe we get someplace from
I
it.
when I speak, and if I saw you share that and I bookmarked it, I haven't had a chance to read it. But when I speak at events, I put up these black and white drawings from like the 1870s of shelters in New York City, and I say, here's what homeless services was like in the 1870s, the 1880s, and I show three or four of them. They're black and white drawings, and then I show a picture of the Glendale Winter Shelter, which I took. It's color, but it still looks the same. Here, 100 years later, we're still warehousing people, and
Mhm.
that's ridiculous. Um, Homelessness in healthcare and the emergency room. A lot of people don't realize this. They don't realize the cost of homelessness to the taxpayer. And what I know some medical professionals that work in hospitals, and they say when it rains real bad or weather's real bad, homeless people flock to the emergency rooms. Sometimes with needs because they're vulnerable, and sometimes it's because they're just trying to get out of the weather. Explain what homelessness is like for through your lens as an
Yeah.
emergency room physician.
Yeah, it's complex. So I work in a city hospital. We about on any given day, around 14% of our patients actually are homeless, either in shelters or unsheltered. So it's prevalent in my ER, and it's a lot of folks who are homeless, use the emergency department for a variety of reasons. So we have people coming in that have homelessness, like, is associated with like worse health outcomes. So people are at risk to getting sick. They, have more chronic diseases. It's harder to take care of these chronic illnesses. And so we do have a lot of people coming in who really need medical care. And that's what I always tell my doctors too, you need to pay attention. You can't just assume that somebody's coming in because they want a sandwich. You need to really listen to them and listen to what they're telling you. If they're telling you that they have chest pain, or they're telling you that their sugar's out of control, you have to listen to them and examine them and do what you would do for any other patient. Take care of them like a doctor. Um, so that said, though, the emergency department is also a place that's open 24/7, and it's one of the only places open 24/7, and we serve anybody. And so, there are folks that come in because they don't have any other place to go. We've actually seen this a little bit with the subways closing too. And it's hard as an ER doc, I have to say, even as an ER doc like me that knows a lot about homelessness and cares a lot about people who are homeless, because we don't have the answer that folks need. Like, we don't have housing that we can give to people from the emergency department, and so that can be really frustrating. And some of our providers actually get burnt out from it too, because they feel, I think doctors like to fix things, right? Like doctors like to be able to say, okay, you have this, I know the cure, I'm going to give you this pill and it's going to fix you. But the thing that we know to fix homelessness is housing, and that's not something that doctors can write a prescription for right now, although I hope that someday we can. So it can be hard for providers too to know that, like, ultimately somebody's health is just going to keep getting worse, and we're not going to be able to like really do what we need to do for their health if we can't get them into housing, yet being unable to do that, which is part of why I see like my job as a doctor and trying to inspire other doctors to see as their jobs really to be an advocate too, and to, just shout from the rooftops that like people can't be healthy without housing, and this is what we need, and we need everybody to help us make this happen.
What's been interesting, and I'm going back a little bit. I mean, like there's before Christ, after Christ. There's going to be before coronavirus, after
BC, it's actually BC too. Yeah.
right. And before coronavirus, there was a movement where like Kaiser was investing in affordable housing, and as you said, if doctors could write a prescription for housing, you would. And housing is healthcare, and housing saves taxpayers money, but it's just so stinking hard to get the political will to do that. So in the chat right now, I just shared a link where you can go and contact your state and federal legislators, and your voice is important. So we need you. We need that. We need that housing. We need, for providers, healthcare providers like Dr. Kelly, and for service providers, we need to get homeless people into housing. Please contact
Amen.
your legislators.
Do it, please.
So since we're talking about before and after, how has the coronavirus changed your life as an emergency room doctor?
Completely. I think it's changed everybody's lives. Our hospitals our emergency departments look much different than they did a few months ago. Things really changed very quickly. So, right now in our emergency departments, most of the emergency departments have set up, entirely different areas for people that are, have coronavirus symptoms from everybody else. What we were seeing for a while was that people that didn't have coronavirus were really afraid to come to the emergency departments. They were staying, away from the emergency department. So like our volumes of people that didn't have coronavirus went way down. And, a lot of people are worried, like, well, what's happening to all these folks that aren't coming in for their chest pain or, their whatever other medical problems they're having. We are, starting to see, at least in New York City, as we have, obviously we still have a lot of coronavirus here, but it's started to level off a little bit and go down a tiny bit. We've seen more people with other issues coming to the emergency department. But, one thing that's been notable to me is that for the people that don't have coronavirus, like coming into our other section of the ER, it's even a larger proportion of people who are homeless than it was before. And I think in part that's because like these are the folks that don't have any other options, right. So they're still coming, and we're happy to serve people. But it's a little sad that that's the case. Yeah. But being an ER doc is totally different now. Everybody, it's a tough time, right? Like people are scared and nervous about getting sick themselves, about getting their family sick. But there's also a sense of, it's also a time where I think I feel, and a lot of people feel, really enormously grateful to be a physician, be an ER doc, and to be able to serve people during this crisis and provide some comfort and help.
Well, let me stop right here and say thank you. Thank you for, I've always been impressed for your heart for people, and not just homeless people, but I could tell you love people. And all healthcare providers right now deserve huge thanks. So thank you. Um, I would like to ask, and and this is still on a BCAC kind of a spin. A homeless person comes into the ER. You would like to provide housing, but there isn't housing. Social workers may get involved. What is the path? There's a homeless person, and you give him referrals, him or her referrals. What is the path for that homeless person before, or has it changed at all? I mean, now that there's coronavirus, let's say somebody tests positive, it is a different path because then they're quarantined and
Yes.
isolated.
Yes.
Can you explain the different paths
Yeah.
of what's happening?
Yeah. So we have two different pathways right now. So that is a change. So we have one pathway for people that don't have coronavirus or coronavirus symptoms. And then another pathway for people that do have coronavirus or coronavirus symptoms. So going to the first pathway, the one for people that don't have any coronavirus symptoms or a test positive for coronavirus, that pathway is the same as what it always was. So, that means that from the emergency departments, we're referring people to shelters generally. I memean, New York City is a right to shelter location. It's unique in that way. So, it's not like the shelters usually turn people away. And so often we're referring people to the intake shelters in New York City. Or, to be honest, if it's a lot of folks end up going back to wherever they were staying, streets or whatnot. So that pathway, unfortunately, in my opinion, because what I would like to be able to do is to offer everybody a safer place to stay right now. But from the standpoint of like the emergency departments, we don't have any ability to kind of get people into hotels who don't have COVID directly, or to get them into any place else. That pathway is all through the shelter system still. But for the people that do have coronavirus symptoms, so if somebody's coming in, they have a new cough, or they have a sore throat, or they have fever, or any of that pathway has changed. And one thing that our Department of Homeless Services has done well is that they did set up they set up hotels to be used as isolation sites for people who don't have the ability to self-isolate. So folks that were living in congregate shelters or unsheltered. And so they do have these isolation hotels now. And so there is a referral pathway that we can get people into those. There's been some growing pains. That's some of what I've been screaming about, but, it's been a little clunky. Processes have changed. It takes some time. We've had, sometimes it can take people like several hours for the transportation come, for them to get into the hotels. People understandably are, get anxious in the meantime. But at any rate, we do have that as an option. So, in New York right now, they have about 700 of those hotel rooms set up for people who need isolation. They say, I think there's maybe around 400 people in them right now. And in those hotel rooms, that's where people can go, to be separated from everybody else when they do have coronavirus symptoms. That Mark touched on this before, but, we would hope, right, that people would be able to go right from those hotels, not back into homelessness. But, what's happening is that people are spending their isolation duration, which they did just increase from, it had been 7 days, and now it's 14 days is the minimum. It's longer if people are still sick.
Wait. I got to stop you for a second.
Yeah.
So we're us house people. I actually had 3 or 4 questions, but I got to stop on this one.
Yeah.
Us house people, we're told to quarantine for 14 days. But when they put homeless people, it was only 7?
So, the guidance has been very different, kind of all throughout. So the quarantine. So I should define terms. So let me define terms.
Okay.
So quarantine is a term that is separating yourself when you've been exposed to somebody sick but don't have symptoms yourself, and that is to prevent other people from catching it. Isolation is specifically is a term for people that do have coronavirus, essentially, or symptoms of coronavirus that you think is coronavirus if you're waiting for a test. So, and again, those people are separated so that they don't get other people sick. So isolation is for people that definitely have coronavirus. Quarantine is the term for people that have been exposed.
Right.
And the guidelines for isolation and quarantine had been somewhat different. So for quarantine, it's kind of has been 14 days, in part because, when you're exposed, it takes time to actually get it. There's kind of a lag, essentially. The time period for isolation from a lot of the guidelines has been, and even in New York City for the general population right now, the isolation guidelines is a minimum of 7 days from the time when your symptoms first started, or 72 hours after your last fever without taking fever reducers like Tylenol, and your other symptoms are improving. So whatever of those is longest. So the minimum duration of isolation would be 7 days from the time your first symptoms started. What happened though was, I can't take credit for this myself, but what myself and a lot of other people said was, well, like, look, shouldn't we be a little bit more cautious if you're talking about sending people back into a congregate setting, like a shelter where they're around a lot of other people? Shouldn't we maybe err on the side of making that isolation period longer? And so, what's happened too is that we've been learning, part of the problem in general with coronavirus is like so little's known about it. And so people are really learning on the fly. And so, it was kind of more recently that people learned that this viral shedding can kind of last longer than what was originally thought, that people essentially can be contagious for longer. And that also contributed to the isolation duration being up to 14 days now for people going back into a congregate setting like a shelter.
Yeah. I wanted to, and I don't know really how to frame this, because the issue of testing has been a crisis. So I'm referring to testing of the homeless population, because you mentioned 400 people in 700 hotel rooms, and I'm just wondering. I'm concerned about this in Los Angeles. Forgive me, most of my, I was homeless in Los Angeles. I lived in Los Angeles. It's where my lens is. It's where my heart is. But I'm concerned that there's a lack of testing in the homeless population. So we really are making guesses here.
Yes. Yeah, you are right, and that's a good concern. And I think, we some places in the U.S. have been faster at rolling out testing than others. In New York City, we've been slow at rolling out testing, especially for people who are homeless. And so, you've seen some places, for example, in Boston, they've done universal testing at a lot of their shelters. And what they found that is concerning is that in shelters where they knew that some people were sick with coronavirus, when they tested everybody, they found rates of positive tests to be like around 30%. And most of the people that tested positive didn't have any symptoms. And so, that is concerning. And, essentially what you're saying, Mark, and I agree, is like, we're not testing, so we don't even know the extent of coronavirus in our shelters in New York right now. It's likely undercounted, but we don't even know.
Right.
The mayor did announce here fairly recently that they are going to start doing more universal or widespread testing in the shelters, and they hope to roll that out by mid-May. The testing is important because it helps us know where to where to put people, like who needs to be in a private room so that they're not infecting everybody else, or who needs to be in a private room for their protection because they don't have coronavirus yet.
Right. Or just how widespread it is in the homeless community.
And exactly that. And so it's been a missing piece, I think, in part. So New York City has so many people, and so many people with coronavirus right now in the city overall. I'm not just talking about the homeless population, that our Department of Health here, and I think rightly so, had said for a long time to preserve the tests for people sick enough to need to be admitted to the hospital. And that makes sense in part for the general population, because for most people, coronavirus is still a relatively mild illness for most people. And for most people, getting a test isn't going to change what you do. There's no treatment. There's no medicine. There's nothing you can do for anybody anyway, aside from wait, really, unless they get very, very sick. And so our Department of Health was saying, look, you shouldn't be doing the testing until, unless somebody needs to be admitted to the hospital, because doing the testing, just like, they get on the subway to go get their test, they're exposing other people, they're wasting PPE, all of that. But the homeless population is different and unique, because you have people in these congregate settings, and you sort of need to know what's going on in order to protect the group. So,
yeah. As you were talking, I couldn't help but think, and there's been some news stories early on how the extremely privileged wealthy, when there was no testing, were able to get tests. And now it seems there's testing. I know here in the small town I live, upstate New York, they're starting to do some, drive-in testing, and it's starting to get, more available, especially as we're trying to open back up. But it's still not going to the homeless population. They're, the unforgotten poor in this case.
Yeah. I mean, I think the COVID pandemic in general has just shown us, the huge disparities that we see in terms of how health is distributed in our society.
Yeah. So, people, we're about at the halfway mark. Our wonderful moderators, Addie and Derek, are going to start keeping track of questions. We're going to chat a little bit more with Dr. Doran, and then open it up for questions. So you can either save your questions for the Q&A, or if you want to ask them now, Addie and Derek. And just so you know, there's a lot of people that are homeless and formerly homeless in the chat room. In fact, both Derek and Addie seem to have on again, off again homelessness. And I'm just grateful that they're moderating for us. What does the future
Hi, everyone. Thanks for moderating.
I'm just so glad that, I know I've said I'm coming down to New York, gonna go and hang out with Josh. It's gonna happen. Until then, at least we got to video chat.
We did.
And Slim, one of the guys, was like, "Damn, she's smart." And you are. I was so nervous. I was like, it's not that anybody I interview is not smart, not intelligent, but I'm really honored that you took the time to be with us.
Well,
so
don't be nervous. I'm nervous. I'm like talking to like the group of the real experts here, and like trying to pretend like I know a little bit about something.
Yeah. But what do you see the future like? I mean, everybody keeps on saying, the new normal. And 9/11 changed us, right? That was the last big crisis, and it changed. We have a new normal. You now have to show your ID before you go into a building to go up in the elevator, and, airport security, and there is a new normal. But what do you see as a new normal for the public and for homeless people?
Yeah. I wish I knew. I mean, part of me, like, so we're still so in the thick of it. Like, we're really in the thick of it here. That thinking to the future is hard to do, but important. And I just feel like there's so much unknown. I mean, I think that this experience is definitely going to change the way that people think about kind of interactions in group settings, and distance, and kind of travel and infection. In terms of homelessness, I really hope that the new normal makes us realize that, like, we can't have 500,000 people in the country be without homes. at the same time, like to be honest, like I'm a little bit terrified because we've got people losing jobs. We've already seen in New York, I've seen, unfortunately, coming into the ER, people that are newly homeless already. So it's I'd like to give like a really optimistic answer about the new normal and how maybe we'll all appreciate each other and
Yeah, yeah.
and hold hands and stuff.
Um, I appreciate your honesty. And so I think one of the things that homeless services does wrong, and I'm not talking about medical healthcare, homeless services, is we always want to say, we're ending it, we're ending it. And I think
Mhm.
one of the realizations that COVID 19, I hope, will slap in the face is we have to be honest. We have to say, we have this crisis. We're doing the best we can. We have to do better. We need your help. These are the milestones that we've made. These are our successes, but there's a lot more work to be done. I don't think that we can paint, and I've actually seen research on this over the summer. Invisible People will be funding some research because the research I saw, I'm not supposed to talk about publicly, at least the source, but the success messages don't work. If you think they do, go watch a Donald Trump briefing, okay? Because all he's doing is patting himself on the back, saying, "We're doing this, we're doing that, and we're great, and we're excellent." So I appreciate. I think we have to be real about the social crises that this country's faced, and it's not just homelessness, but we have to
Yeah.
do it with a measure of hope. You know,
I
you
thought of something optimistic to say. Can I say
good. Yeah,
something
of course,
optimistic?
please.
I do think, and this is related to stigma too, but as we have more people entering homelessness and more people just in a position where they're realizing what it's like to, not be able to pay their rent, all of a sudden, I'm hoping perhaps that
Yeah.
maybe changes some of the stigma, maybe gives some people more compassion, and maybe just makes them realize that, hey, like I could be homeless too, or I
Yeah.
did become homeless, and so maybe some of the public perception could change.
I am torn on that one. I hear you. I agree, but my concern is that some people that have been unemployed, that have never gone through a food bank and are now
Mhm.
going to be go through a food bank are going to get more conservative and more selfish. They're going to
Yeah.
start hoarding and saying, you know what, this is mine, this is us, we work for this. And I hear you. I'm praying for it. I hope hearts open,
Yeah.
but we'll see, we'll see. And for the advocacy, community, and for what I do with Invisible People, we have to figure out ways of reaching people and educating them. And we haven't talked about this, but one of the things I love about the messages that you share is you try to educate your peers about homelessness.
Yeah. And in fact, actually, and I need to give a shout out to you, Mark, and to the support group on Facebook. I don't know if people even remember. Can I tell this story?
Sure.
That because Mark helped, because I wanted to learn, I wanted to hear more, and so Mark posted a question for me about, what do you wish that doctors knew about, about patients and people who are experiencing homelessness. And people were really generous in their replies, and agreed for me to use what they said without
Right.
identifying anybody. And actually, right before coronavirus hit, I was slated to give a lecture to a whole group of young emergency physicians in training down in Philadelphia. There were people coming from like the whole mid-Atlantic area, and I was really excited because the whole lecture was based on quotes from that WAVE support group. And then, lessons that they should take from these quotes and sharing the voices. And unfortunately, that lecture got canceled because of the COVID crisis. But I'm hoping to be able to do that again because, there's a lot of education that needs to
Yeah.
happen for my peers. And I guess just having also read all of the stories too, and just seeing also what
Yeah.
sometimes happens in the ER. I guess just an apology on behalf of us medicine
Yeah.
for bad experiences people have had. Trying
Well,
to make it better.
the harmful beliefs and stigma has been reinforced for years. I don't think anybody's bad. They're not born bad. It's they have had this experience in life, and that's the lens that they see through. They see the homeless person as a drug addict, a bum, and even medical professionals see that. Even people that work at HUD see that. Even people that work in homeless services see that. And that's where education is important, and connecting to homeless people. So um, the one thing that I know that validates all this is the homeless sector rarely empowers homeless people to speak at events. It's always formerly homeless people. Well, why? Because of the stigma. Homeless people are difficult. People are difficult. When I first started this, right? I'm gonna blow my YouTube monetization by swearing. I won't say the f bomb, but I used to get nervous, like, okay, well, all these homeless people are reaching out on social media, and what happens if I start amplifying their voice, and what if somebody gets difficult? And then I realized, well, all people are difficult, and there's house people that are assholes, you know. It's just that stigma. So I am now going to go to a couple of questions. The first one is from Addie, and this is more of a medical thing. She was asking, uh, they're putting people that have passed away from the virus in cold trailers. She doesn't know why. Why would you refrigerate bodies?
Oh, well, so, usually when people pass away, they're put in morgues into, freezer units. And, keeping the bodies refrigerated helps to, kind of decrease how quickly
Yeah.
they decompose, essentially.
Eh,
So they've had to put the trucks because unfortunately in New York, the morgues that are attached to hospitals, a lot of them have filled, and so that's why they've put the trucks there. But that's not permanent. That's just
right.
where bodies rest before they're buried.
And that was because of the backlog. There was more
Yeah,
than most hospitals have
yeah,
a morgue that's refrigerated or
hmm
cooled,
yes,
and storage, and then there's a funeral home, and there's a process. Well, there were so many deaths happening all at once, that they had to bring in refrigerator trucks to increase capacity, which
yeah,
is heartbreaking, actually. I think visually, that really, really brought it home.
yeah, yeah.
Uh, so we're going to stick to medical questions.
Okay, that's why
Folks,
you brought a doctor on your show,
right,
right?
right, right. Well, I'm getting political questions like, why are states opening up when there's still not a cure yet? And the simple answer to that,
Trump. No.
yeah, the simple answer to that is we have another crisis, and that's the economy. And
Yeah.
that is just as scary, but to me, it's humans before profits. Um, and you were talking about a silver lining in all this, and my hope of the silver lining and connected to homelessness is that I hope that what this does for us as a society is that we figure out a way of providing health care and housing for people that is not, in 5 years, trucks will drive themselves. Automation's going to kill jobs. Coronavirus just sped it up. And now you're going to see businesses invest more in automation. So this job loss was going to happen anyways in 5 to 10 years. So my silver lining is that this is a wake-up call for things like universal basic income. And I'm not talking Andrew Yang's universal basic income. That was more, I believe, brilliant political ploy. But a universal basic income has to cover housing. It has to cover basic needs such as food, utilities, cell phone, bus pass, clothing, some quality of life. Otherwise, it's really not going to be much of a help to people that need it. So my silver lining is I believe coronavirus, I hope, will fast track us in that direction, and that will also help end homelessness, end or prevent homelessness. That's my hope. But that is our only question on the political. Oh, I lost my. This is new for us tonight. So I have Connie
Yeah,
G.
I'm looking through the chat too, trying to
Sure. If
read.
you see something, Connie G just wanted to thank you.
Oh, well, thank you, Connie. Thanks for listening.
Um, how has your life changed? I know how your
Uh,
life as a
yeah.
doctor changed. How has your life changed?
So a lot. I think life has changed for everybody. So, I used to on a regular day go into my office and do my work, and my kids were I have two little kids, and they used to be in daycare and preschool. And so that's changed. Now everybody is at home. My husband, I was mentioning to Mark before this started, my husband's a freelance cinematographer, so he's not working very much right now, obviously, because people aren't, shooting commercials, and that industry has really shut down right
Right.
now. And so he's watching the kids, and I'm at home, and it's tough going to the hospital because you might be getting infected. I have like a whole routine now that's different for me when I get home from work of uh, taking off. This is like, I don't want to say this on YouTube either, but basically like just making sure that I'm not bringing the virus into the house. And so that's different, and we've kind of cordoned off the like we're obviously we're fortunate. We're very fortunate. We have a house that gives us enough space where I have been staying in one room, and trying to stay a little bit separate. But
Wow.
it's changed. You don't get to see family,
That's got to be
like
hard.
elderly parents. Yeah. Yeah, it's hard. I think a lot of us, especially thinking about like trying to see our parents who are elderly and at risk from disease, you can't really, if you're being exposed to coronavirus, you don't really want to go visit other people. You don't want to put other people at risk. And
Yeah.
um, yeah, so life has changed a lot. And then I guess my Mark knows this and pokes fun at me, but my usual job is that I'm usually a researcher. I usually do a lot of research. And during coronavirus, like that work has just seemed less critical to me.
Yeah.
And so I've been doing a lot more
You
advocacy
brought it up. You
than I
brought
usually
it
do.
up. You brought
I
it up.
know.
You
Sorry,
brought it
Mark.
up. I was.
I've
That was.
so I've been thinking a lot.
I asked you. Are there any no topics? And you didn't say anything. And I was going to be nice. And I don't pick on her for research. I think research is important. I mean, Invisible People is going to champion some research, hopefully soon. I just think we've gotten off balance. I think we do a lot of research on shit that doesn't matter, and some of the research that's being funded is common sense, and the research that's really important we need to do more of, and that's my take. And I hate PDFs. So speaking about research and PDFs, in the description, Dr. Doran worked with a couple other people who I respect on some research. And there's a link in the description, and there's a link also in the pinned comments. If you would like to know more, please feel free to do a deep dive and click on it. And I've been sharing her Twitter so that you can follow her and ask any questions. But we have one Lady T, who is a Invisible People family. She wants to ask if the doctor thinks that masks and social distancing will be around for a long time.
That's a good question. Again, I wish I knew more and could predict, but my guess is yes. I mean, I would think yes, like at least for a year, maybe longer. So I do think, and by social distancing, I don't want to scare people. I don't mean that like everything's going to be shut down and you can't go anywhere for that long. I just, I think that people are going to be wearing masks and trying to kind of be mindful of their distance for a long time now. Can I give a shout out on the video I see in the chat? Also, another researcher, Stefan Curtis.
Yeah.
And if folks want to follow him on Twitter too, I see he's fielding a couple of questions in there. He's another researcher, activist with a big heart, and that always has been a big champion for people. So.
And he went and interviewed some homeless people himself. And
yeah.
Stefan, you better watch it, because we might have to give you a job in the chat room on Sunday nights. If you're answering questions, that would be really great. So Vincent asked, and I cannot pronounce it, but the malaria drug that Trump is touting. Can you talk about that?
Yeah, so that's if you want the easy way to pronounce it, that is Plaquenil is the trade name for that. It's hydroxychloroquine. And there hasn't been any strong evidence that that drug works. It was touted for a while. And I think people got their hopes up, sometimes in like a very dangerous fashion. People got their hopes up. But it's something that we're studying. So hospitals are studying it right now. There's a lot of trials going on to try to learn more about it. Because we don't have a good coronavirus treatment yet, some places are kind of using it, just for lack of anything better. But there's no great evidence yet that it works.
Yeah. I just saw a question Jeff asked, and I thought it was interesting, even though the answer is probably the same as testing. Jeff asked is, once there is a vaccine, will it become available to homeless people? And my simple answer to this, it'd be just like testing. The rich people got it first because they were able to give money to some doctor, then the normal population, and it would probably not be fast-tracked to the homeless population unless there were hot spots and they were worried about the general public getting infected. Am I right or am I wrong?
Yeah, I mean, I would hope that a vaccine would be rolled out widely. I think that if there's a vaccine, they'll probably start with groups like healthcare workers and other people who might be, spreading the virus or in contact with it a lot. I would hope that folks who are homeless are prioritized because of, the various risks they face from coronavirus. But, the healthcare system in the U.S. is so different and fragmented. I mean, one thing I can guarantee is that it will undoubtedly differ state by state and locality by locality. So you'll probably see like different forms of rollout every place.
Yeah. One of the things, and I saw Jeff's question, so I kind of went with it. But when we're talking about, the new normal of masks and social distancing, where so far I have only gone out of the house for grocery shopping. And it's interesting because when I worked in television, I was nasty. I never smiled. I hated people. I was the grumpy man. I was known for yelling at employees. You can hear me buildings over, right? I was that guy, right? I literally when I was mad and I would walk through one of the buildings, people would come out of their office, see me, and then go hide. I'm not joking. I mean,
Wow.
I was nasty, nasty, nasty. And then I was homeless, and I had to learn how to connect with people. And one of the ways that I learned how to connect with people was smiling. So I'm that guy in the elevator that smiles at you, right?
Mhm.
And most of the time, people smile back. This wearing the mask, there's so much. Most communication is nonverbal,
Yeah.
and it's through your facial expression. So not only do like I'll say a bad joke, and they don't know because they don't. Well, they know it's a bad joke, but they don't know that I'm joking because they don't see my facial expression. That really is unsettling to me. And then I don't see them. I don't see if they're. I just see this mask, and it's kind of, people bitch about social media, saying that social media is making us antisocial. Well, the coronavirus is making us antisocial in
Yeah.
many ways.
Yeah, it's hard to, like in the hospital, even talking to patients, everybody's wearing masks. It's hard to get your point across. So you mentioned smiling, which is my funny smiling stories. I used to smile at everybody on the street because I grew up in the Midwest in Pittsburgh. People from Pittsburgh think Pittsburgh's the Midwest,
Yeah.
and then I went off to college in Boston and nobody was smiling, and I was so confused. I kept smiling at everybody and they were looking at me like I had two heads. And finally some lady smiled back at me and we started talking, and she was from Pittsburgh.
Oh
So
wow. Um, so obviously Dr. Jim Withers,
hmm
which
I
is
don't know him, no, because I moved away
really
when but I know of him. So
because
I know of him and of his work and respect him. Yes.
yeah, because I through the homeless healthcare, I thought you might.
Mhm.
Um, I'm going to ask two last questions, but are you seeing, since we got on the topic of masks, are you seeing, the term is PPE, personal protection equipment,
Mhm.
and are you seeing homeless people, masks being distributed? I know myself, I was trying to get masks for people in LA. It was really hard because there were no masks. Now a lot of people are manufacturing them and selling them, and I've seen some groups distributing them to homeless people, which is brilliant. Is that happening in New York?
Yeah, so our Department of Homeless Services now is distributing face coverings. So some type of face covering, it might not necessarily be a surgical mask, to folks in the shelters. Um, I'm not positive, like with all the subway sweeps, I don't know. There have been reports that like some of the advocates that have been down there have said that they're not distributing masks to everybody. But most of the folks I've seen coming into the ER do do have a mask, and if they don't have one, we give them one. Um, so
Very cool. Well, we're going to wind this down. Thank you for being with us. Any last words? What would you say to, the general public, homeless people, anybody? And it could be about anything. It could be about the virus, it could be life or homelessness. What are your last words? Close us out here.
well, I want to thank you again for having me. I guess I would just say, especially this group, like this is such a hard time. I know it's such a hard time. It's a hard time medically, it's a hard time emotionally. So like, please reach out, use resources around you if you need help. I know that a lot of people are in situations where it's really hard to stay safe, but as much as you can, please try to stay safe.
Well, thank you very much for taking an hour of your Thursday night. Was it painful? Was it okay?
It it was okay. It was a lot of fun. Thank you, Mark. And I hope we can do it again sometime when there's not like a pandemic. And
Well,
I really do. I feel for everybody, and I hope that we can really all push together to just make it so that next time there's a pandemic, we
right.
don't have so many people in shelters in the streets.
Well, you were saying that you weren't able to do your presentation, and probably, I don't know who the audience is, but we could do it like this.
Oh, you know what? This is okay. I now I'm gonna ask you to return the favor. And now I have all these ideas now of how we're gonna tag team and do presentations and maybe pull in somebody who's still homeless and
I,
uh, educate a bunch of docs.
I
So we'll
know
have to
I
think
know
about that.
a couple of people in the chat room and in the group would be more than welcome to help you out and make it a live thing. Might be really cool. So
Yeah,
when you,
I'm gonna send some emails tonight.
very cool, very cool. Well, thank you very much for spending the time with me, with us.
Thank you. Thank you, everybody.
You got have a good night.
Take care. Night.
So let me. How'd you guys? I mean, oh my gosh, she's smart. Uh, she has a big heart. Um, I just want to thank all of you uh, for being with us. Um, you know, normally we do these on Sunday nights. For any of you that are new, about 2 years ago, we started doing these chats. You guys know this, right? I've been threatening I'm going to produce a show. I'm a TV producer. This is what we do. I've been asking you for suggestions. We're going to produce a show. And you guys just want to chat. But I thought tonight was amazing. I've shared Dr. Kelly's Twitter, and it's also in the description. Follow her. If you're the world is talking about coronavirus, whether it's CNN or Fox or whatever, and you're getting all this madness, follow her. She's just grounded and brilliant, and she'll tell it like it is. So, you guys think we should still do Sunday night? That means you would get 2 live streams in 1 week. I know you're going to say yes. So Sunday night we'll be back on at 8 o'clock. Thank you again for everybody that joined. Thank you, Addie. Thank you, Derek. And once again, thank you, Dr. Kelly Doran, for enlightening us and spending Thursday evening with us. So until Sunday night, you guys have a marvelous, marvelous week.